Yeah, I was just prescribed this,
Okay.
and I've never taken it before. And honestly, it seems like a really high dose, and I've been searching. I was on Bing earlier, and it said like a lot of people experience muscle pains, and that seems like a high dose. I'm kind of concerned about that.
Okay, so you're actually on Atorvastatin 40 milligrams once a day.
Mm-hmm.
This is a high intensity statin, and there's multiple reasons why you could have been prescribed this particular dose. I'm going to pull up your information. Okay, so it looks here like your lab values indicate that your LDL was above 190.
High score. That's good, right?
Well, not exactly.
Oh.
So the LDL is the bad cholesterol, so we actually want to decrease those levels. And the LDL lab value is the first thing we look at when prescribing a statin. So this is actually the perfect dose for you, being on a high intensity, since the LDL is above 190.
Okay.
So don't need to worry about your dose being too high. This is exactly what you need to be on. So another thing that we look at when prescribing statins is the 10-year ASCVD risk.
Okay.
And this is based on multiple factors such as your race, your blood pressure, your cholesterol, if you smoke, have hypertension, diabetes. And so if this score is above 7.5, you're automatically indicated to be on a high intensity.
Okay.
So when plugging in your information, we see that your 10-year risk is 17.5. So you are definitely indicated to be on a high intensity along with your LDL level.
Okay. Got it.
Okay, so you said when you came in today that you were worried about muscle pain. Is there anything else that you're concerned about?
No, it's just the muscle pain. I've read it can be severe.
Okay, yeah. So with statins, there is always a chance for muscle pain to occur, but this is an uncommon side effect. However, if you were to experience any muscle pain, just be sure to give us or your doctor a call and we can adjust accordingly.
Okay. Thanks.
So an important thing with this medication is that you take it every day and doing your best not to miss a dose.
Okay.
So if you have problems remembering, you can set an alarm, put it by your toothbrush in the morning.
Okay.
Just little helpful ways for you to remember because it is really important.
Okay.
And then also along with taking this every day, your diet is really important too. How do you feel about that?
I don't feel it, but
Okay.
if I need to.
All right, well, just a few little tips. Try to decrease your portions, so maybe not fill your plate completely. You can also snack in between meals, and this will help overeating. Fruits and vegetables. You don't like fruits and vegetables?
But I'll try. I'll give it a shot.
Okay.
My wife is
That's good.
nervous. I'll
Baby
give
steps.
it a shot.
Okay, well, good. And then if you're having any problems figuring out what you do need to eat, there is a website called myplate.gov.
Okay.
And you can go on there and they'll help you with your meal plan.
I like that.
So what other questions do you have for me today?
I think that's it. Doctor told me about exercise. He told me about diet and making sure I take it every day. So I'm ready to get healthy.
Okay, well, good. And if you have any questions, be sure to give us a
Okay,
call.
see ya.
Today's topic is atorvastatin, or Lipitor, and it is an HMG-CoA reductase inhibitor, but more commonly known as a statin. It is indicated for dyslipidemia mainly, but it can also be used for heart attack and stroke prophylaxis.
So, when you inhibit HMG-CoA reductase, you end up decreasing blood cholesterol because you're inhibiting cholesterol from being made. So this in turn upregulates the LDL receptors on the liver, so you end up bringing more LDL into the liver so that it can be excreted by the body. LDL is the bad cholesterol. These are the low density lipoproteins. The HDL is the good cholesterol that you can get from good fats. So this is the high density lipoproteins. It's also important to note that something really cool about this drug is that it can increase your good cholesterol while also decreasing your bad cholesterol that's going to be causing the problems. Also, it can decrease your triglycerides, which are also bad.
So you're going to take this drug by mouth. It is metabolized by your liver and then excreted through your feces.
Atorvastatin is metabolized by CYP enzymes. It's important to note that something like grapefruit juice can inhibit the CYP enzymes and therefore increase the blood levels of atorvastatin.
It is important to take your atorvastatin at the same time every day, and you can take it with or without a meal.
So the biggest side effect with this drug is muscle pain. So the minute you feel any type of muscle pain, just be sure to let your doctor know. It also can cause some GI side effects, so it can cause you to have diarrhea, some cramping, anything like that. So if you're pregnant, planning to become pregnant, or breastfeeding, you should definitely tell your doctor because this drug is not for you.
Make sure and talk to your pharmacist if you plan to take any extra medications over the counter, because there might be some interactions, and that's important to know.
Thanks to Lipitor, I can finally check things off that honeydew list my wife gave me.